The problem that we were dealing with was trauma related to journalists and also people who work with journalists in conflict situations. And one of the things to be mindful of when we're talking about this is that it's not just journalists. This is fixers, this is translators, this is anybody that works out in the field with journalists. And it's looking at the idea that you have young journalists perhaps who go off into a situation where they perhaps don't have a lot of experience, come back from the situation and don't have anyone to talk to, and also perhaps that out in the field you can in that way endanger yourself and other people and your own mental health. But also that this is not something that's exclusive to young journalists. This is something that can happen at any stage along the way, and that while there are so many resources for journalists out there, and I'm sure that we all know this, there's LinkedIn, there's Twitter, there's, the Vulture Club was something that we all came up with. We didn't all come up with it, but it's something that came up in conversation. That there are many ways for us to connect to other journalists in this situation, but that trauma is the thing that falls in the gap. So there are so many ways for us to connect and to talk to one another, such as there is today, but we don't talk about trauma perhaps because it's a shameful thing or because there isn't a forum for it. So we were looking at ways to get tech to connect to that need specifically. I haven't been talking into the microphone so far, have I? Specifically based on the need of trauma. We spent a lot of time brainstorming the many ways in which trauma permeates experiences that we've all had and other people could have. And I really want everyone watching this presentation to take this as an open invitation to take this further, hence why we have such a beautiful low-tech thing here. It's an invitation, right? So yeah. The problem that I think I've effectively outlined the problem that we came up with, but we looked at ways to kind of take the needs that people have around trauma, and those are based on social support especially, and again connecting it into pre-existing social networks, but also making space to make trauma a priority. And so aiming towards building some kind of a platform or looking at ways to connect into other pre-existing platforms that prioritize trauma, and in such that the user can, well, perhaps I'm jumping ahead to solutions a little bit, but also emphasizing, data security and various other things which don't, in the act of you as an individual coming to other journalists and talking about this problem, that you don't, again, endanger yourselves or others. So we broke this down into we actually broke off into 3 groups to discuss this because we feel that these are 3 parts of the problem. And we sort of, in looking at finding solutions to trauma that eventually would be built into a bigger online platform where these might be parts of the online platform, we looked at mentoring resources available to journalists in question, and also community and networks. So maybe you're going to talk about.
Can I have one note?
Okay.
So Bruce Shapiro, who was here but had to leave early, mentioned that at the Dart Center, there's a lot of resources for this, but they haven't found a way to negotiate bringing this online and bringing it virtual. And there's a lot of actors who are in different spaces who are hooked up with networks and are able to access things like this, but there's also a lot of single actors with not many resources who are alone, who perhaps live in these sites where they're working and reporting on. And so there's an issue of people being able to easily access these resources versus reaching out to them. And he wants to explore this, but the Dart Center is trying to figure out how to do this in a way that is effective in terms of trauma, but also respectful of people's privacy and making it an effective thing. In addition, we were looking at ways that you help people before they go and report, while they're there, and then after they come back, because there's different needs at each point. And so I'll talk about resources, but I'll let Hernan start off. Wait, no, you start off with talking about mentoring.
Actually, I lied.
So basically, we thought that both young and more experienced journalists may all be in need for help, if you will. Probably more so the young journalists, especially before. Say for example, a 22 or 23-year-old maybe freelancer, maybe not, who's gonna be going to Afghanistan or Syria or, pretty volatile type of situation. And you would think that the person's probably pretty smart and maybe has done his or her research, but all the research in the world probably doesn't compare to actually talking to somebody who's already done it, and maybe done it a million times, maybe done it there and other places. So we started thinking about how would we be able to help that person who's going to be likely experiencing some kind of traumatic situation, and probably rather quickly, maybe as soon as they hit the ground. So there's different ways that we thought this could happen. That there are informal networks already there. As Ruth mentioned, there's this Vulture Club, and I don't know if people have heard of it. It seems like some people have, some people haven't. It's this private, I hadn't before coming here, private Facebook group, for like war correspondents or people who are going to go reporting conflict zones. And a couple other websites were brought up. So there's a couple of sites, small type of projects out there. Seems like in general they're meant for kind of logistical type of things. Not necessarily looking at the trauma aspect of what you can deal with. The psychological impact, both of the people that you're going to be encountering, places and people you're going to be encountering, and the impact that's going to have on you personally. So the idea was to create some kind of networking system. If we can, some kind of formalized networking system where these journalists might be able to access somebody even rather quickly if we could. If, for example, you're already in the ground, prior to the ground it's probably easier. But even when you're on the ground and, for example, you don't know if you should go into a certain place or not, or who you should look to talk to or not, maybe if you can access somebody through like an app or something like that. An online portal might be another idea, but in case there's no internet access, think of some way that we can come up offline that they might be able to reach out to somebody. So again, the whole point is to be able to develop a network where we get experienced people, both writers and editors, who would be willing to participate in this project, volunteer, if you will, and we develop a database. So we'd be able to have this readily available for people to be able to get mentored before, during, and after they come back, so that they can essentially, eventually turn into knowledgeable people that can help other people as well.
We were also brainstorming about different things you could do, to where some people, they're like, oh, I'm fine, I don't have any problems, or maybe they have symptoms, and so that maybe they're reaching out to and maybe they want to self-assess what's wrong with them, maybe they want to be part of the community, maybe it's a family member who's had a problem. So there's a lot of different entry points for this that you have to be mindful for, and there's a huge range of resources that can and would be useful. So aside from the more specialized psychological support for certain types of in-depth trauma, we were talking about checklists, contact lists, case studies for people to listen to and watch. We were thinking about doing something similar to the Dan Savage thing.
It gets better.
It gets better. So journalists talking about, like, the first time I reported in a conflict zone, or I had this traumatic situation where a contact got killed, and talking about how they dealt with it, right? Testimonials. Because the reality is trauma is something that's not accepted and normalized as something that people who work in conflict zones deal with. So it's a serious issue. We were also talking about doing some sort of like radio podcast where people would talk and then people could phone in and ask questions. This could also be done in a chat room situation, right? There is also documenting best practices and worst practices. So for instance, when doing interviews, you don't just dive right in and ask somebody how that rape went, I mean, like there's certain things that you do and you don't do. And also when talking about trauma, there's certain things that can make it worse and make it better, and a lot of people don't know what those are. And so getting advice on how to navigate that when helping someone else. Another thing is that just fundamentally a lot of journalists don't take very good care of themselves in conflict zones. They're working hard, it's a stressful environment, so tips on taking care of yourself. There's much more, but I'll stop here.
Okay, so the third part of this was kind of looking at how communities and networks could build into this structure such that it would be helpful to the people in question. So, for example, it would be looking at ways to utilize other communities such that they could get involved with this. So actually it's kind of going back to the ways we actually discussed upon yesterday, which was looking at, for example, getting people who work in the medical profession or psychologists involved, such that they can network with people. So it's not just journalists talking to other journalists, but it's people that work or professionally trained to deal with trauma, for example. So tapping into communities and networks such that it's helpful for the journalists who are engaging with it. And one of the ideas that we came up with towards the end of today was to build. We actually compared it to using a house. Well, using a house, we would have this is a platform that we're talking about, and that when you're using this, when we say a house, it would be some platform for accessing all of this information. So maybe it's a forum, maybe it's an app, or there would be, a forum and an app, and that parts of this, all the parts of this would be different pages within the forum, so that and you would, you could choose whether you were anonymous or not anonymous in accessing these different parts. And so you can choose to access different parts of the community or the network based upon your need and the trauma, and also focusing on the before, during, and after element of this, that people's needs in these situations are different based upon whether they're preparing to go into a situation, whether it's in the situation itself, or whether they're in a long-term recovery kind of situation, or perhaps don't realize they have a problem until a lot later. So what we've come away with from this, as I think you can probably tell from this beautiful paper diagram that we have, is that the main obstacle that we hit, and we definitely hit this in terms of trying to work out how to present it to other people and trying to work out how to carry these ideas forward, because really the thing that we kind of faced up to here repeatedly is that, okay, this isn't a sexy problem. Like, this isn't a problem that we can drill down with and kind of, bring up lots of kind of, it's not an easily solvable problem where we could bring up lots of things that look flashy and kind of exciting. It's a real problem that we have that journalists are definitely in need of. Like, when we were doing sign-ups for this group, it was all journalists and no tech people, which is not to have a go at the tech people here, it's just to highlight that we have a need for this that really needs to be carried forward. And definitely, as part of what I do, what we're doing at Frontline Freelance is something that we are aware that this is a need that we have, and that there are low-tech responses to this that we've come up with as a group, but that we're hoping that everyone in this room treats this as an invitation to pass this on to potentially come up with high-tech solutions to this problem. So the low-tech or slightly more low-tech solution that we came up with at the moment is to have a listserv, and that can tap into the TechCamp listserv of emails, list of emails that we will have after leaving this room, that we actually just passed around a piece of paper among us and all put our emails down and started talking about how to move that listserv forward such that it could serve the problems that we outlined here. But that what we were hoping, or what we really want, and something that is really needed, is that someone would take that and build a more high-tech platform to this. Again, going back to the house thing that I mentioned just now, where you would have more of a high-tech platform that could respond with tech, because it's a tech conference and you need a bit of high-tech in this, to people's needs. And that you could then, from having a more high-tech platform, you could then look at having offshoots into apps, and then how you can develop the tech to respond better to people's needs. Again, the before, during, and after thing, and being more responsive to trauma, rather than just having a listserv, but you can take it forward using technology. So again, something that we really wanted to emphasize as a group to everyone here is this is a need. This is a real need.
It's not an easily solvable need.
Exactly. Like, it's, we hit a lot of snags. Like, we spent so long talking about the problems and the many facets of this problem. This isn't really a problem that can be solved in a few hours, if only it could, but it can't. This is something that will take some time and some effort, but there is a need there if there is the person or the organization or the group with the time and the technological know-how. One of the things that I will be doing research into who will use this and how many people will be willing to use this kind of service. And I'm very confident going forward that a lot of people will say, well, actually, yes, I think this is a really good idea, and this is something that will be of benefit to the wider journalistic community. So think of this beautiful piece of paper as an invitation.